Well, with all that we've already been through with the pandemic, now there's concern as the weather gets colder that 3 viruses are starting to gain traction across the United States. So it is being known as the tripledemic, with flu, COVID-19 still, and RSV. Children with RSV and other respiratory illnesses are already straining some American hospitals. The flu is already here, and some health experts say new subvariants of Omicron could cause COVID-19 infections to surge again this winter. So as always, when there's good news, we bring in our 9 health expert, Dr. Coley. So tripledemic is scary, but it's important to talk about because you're talking about 3 things. We expect a wave of flu, maybe the likes we haven't seen because we're not masking anymore.
That's exactly right. I mean, what we are seeing now, we expect in mid to late winter. So this is incredibly unusual this year because we're seeing so early RSV activity. In fact, as early as the summer, which we don't usually see. We're seeing flu activity in mid-October. I mean, the CDC even tells people to wait until Halloween to get their flu shot. And so many of us are not even yet vaccinated. And then COVID is continuing to have its new variant. So it's really been the perfect storm of taking off our masks, having naive immune systems that have not seen these pathogens for the last 2 years. So loss of hosts around. And we think the viruses may have evolved as a result of our behavior to change their pattern as to when they have peak exposure.
And we're all getting together again. We're acting like it's over, like we moved on, right? Is that a problem?
It's a huge problem because in October, if we're seeing this, we have some hospitals already at capacity putting children in the hallways because they're running out of hospital beds. You can just imagine as it gets colder, we congregate more indoors. When we normally see the peak, what we could expect is an exponential increase in these viruses.
You think of those hospital staffs, I mean, I don't know much more they can take, but yeah, typically when you talk about children, you know, if you have a baby in the winter months, they always say, in the winter, be aware of RSV. To have it happen this early, but RSV, adults get it, but it's really like a cold.
Yeah, everyone can get it. Most of us have gotten it before the age of 2, except for the pandemic babies. They're very naive.
They haven't seen any.
They haven't seen it. So when
you mean their systems are naive?
Their immune systems are naive to the infections. They haven't seen them.
Yeah.
When we get it as adults, it's generally a cold. So I like to think of it as neck up in terms of symptoms. You know, you have a stuffy nose, you have some sinus pressure, headaches, maybe a low-grade fever. When children or older adults or immunocompromised individuals, it's called lower respiratory tract. That's when it gets into your lungs, starts to cause that pneumonia, trouble breathing, needing ventilators.
Australia is always our canary in the coal mine when it comes to how the flu season's going to be. Apparently, it's not a good look this year. Australia had a bad flu season, and that's coming our way. People can get flu shots, and they can be anywhere from 20 to 70% effective. COVID-19 vaccines, very effective. Is there anything you can do about RSV?
Not too much. So we don't have a vaccine yet, but it's coming. So Pfizer's already released some data in August, actually, that they have a vaccine that's 85% effective in older adults. Moderna's working on one as well. So I think next year, when we're having this conversation, it'll be a triple vaccine, our first ever RSV vaccine. But in the absence of the vaccine, we can still do many of the other things that we know prevent respiratory infections from spreading.
You said it's highly contagious. And so I know that one of the temptations when you have a new baby is to show the baby off, but I mean, no. Don't do it.
We just have to be careful because when babies get it, it gets into their lungs, and that's when you really see that wheezing, grunting. They can end up on oxygen, and you know they can get super sick.
So really, all winter we should practice this.
Yes, and this is a warning sign. Think of it as a warning sign to us from the viruses that they're getting ready for war. I mean, they're really suited up and armored, and they're already going to war in October. So come December, January, we really need to have our guard up.
Wow. Well, there's a lot to consider, but there's a lot of information out there. Hopefully people take advantage of that information, heed it, and try to stay safe. And let's hope this tripledemic doesn't last too long. Thanks, Dr. Coley. Always good to see you.